Uh, Today we will discuss about the last worksheet that I uploaded. Okay, so you can see here on my screen. Okay, so this is the worksheet of reproduction. Okay, so with that we will discuss today. Okay, the first question is, the human menstrual cycle is controlled by 4 hormones. Figure 2.1 is a diagram that shows the site of production and the target organ of these hormones. Okay, now here if you look toward the figure, so this one is pituitary gland, right? And this pituitary gland is producing a special hormone. This pituitary gland is producing special hormone, and that hormone, well, that hormone are actually stimulating organ Z. Along with that, like in day 12, 14 or 13, 14, between that and especially day 14, this pituitary gland also secreting another hormone called what? Luteinizing hormone, and that are stimulating organ Z. And later on, organ Z producing another hormone called progesterone. But before production of progesterone, this Z organ producing hormone Y, and hormone Y also make the uterus lining, endometrial lining thick. Okay, and later on, this organ also producing progesterone hormone to maintain the thickness of the uterus. Okay, now here we have some question regarding this. Our first question is, what is we name the hormone that is produced by X and Y. So if we move toward our slide back, we will see here what should be this hormone. Definitely we know that pituitary gland producing two types of hormone. One hormone is hormone X, right? Another hormone is LH. So the X hormone should be follicle stimulating hormone. This pituitary gland will produce that before luteinizing hormone to make the follicle cell mature within ovary, right? So Z is actually ovary. Z is what? Ovary. Because these two hormones are stimulating the ovary. Is it clear? Now, ovary will produce another hormone that make the uterus lining thick. That hormone is estrogen, right? And when ovulation happen, the corpus luteum will form, and that will start production of progesterone. Okay, to maintain the thickness of endometrium lining. Here, now the answer for the Y should be estrogen, right? While the name organ, so the follicle stimulating hormone and LH stimulating actually organ Z. Why? Because follicle cells are there in organ Z, and organ Z is ovary. Okay. If some of the students want to write, they can. Okay. Yes, organ Z is ovary. Okay, because LH and FSH hormone work on that. Yes, you can also write FSH, follicle stimulating hormone. The short name for if follicle stimulating hormone is FSH. Okay. Now, another question we have, describe the rules of progesterone during menstrual cycle and pregnancy. So what should be the rule of these two hormones? Okay, so the first thing is during menstrual cycle and during pregnancy. So actually progesterone will secreted after ovulation, and progesterone well secreted by corpus luteum. So during during menstrual cycle, not menstruation. So during menstrual cycle, it main, it actually maintained the endometrium lining thick and also increase development of blood vessel to endometrium lining. Okay, it actually during menstrual cycle it prepare the uterus for implantation. Is it clear? Okay, now during pregnancy, what should do it? The endometrium lining that already developed in, okay, so it's actually maintain it. Okay, now you can see here, maintain the endometrium lining of uterus and prepare for implantation, and promote development of blood vessel. And also remember, it also like after ovulation, this hormone also prevent FSH secretion and inhibit LH. Why it's preventing FSH and LH secretion? Because so that no more follicle cell mature and there may be no maturation of other follicle cell, so that no more egg cell release and no process of fertilization happen. It means again the development of it actually prevent again development of embryo, right? Because one is under the process. Okay, is it clear? All right. Yes, I discussed it. Okay. Yes, estrogen actually initially estrogen started working initially before ovulation and making this endometrium lining thick. And after ovulation, that thickness well maintained by progesterone. Okay. I think it is clear. Yes, Malak Hani, you are also right. It also promote development of mammary gland. Very nice. Okay, up to here it is clear. So let's move toward another. Now we will discuss about many medical experts agree that breastfeeding of babies is better than bottle feeding using formula milk. State two advantage and one disadvantage of breastfeeding milk, right? So the first advantage, like breast, we are here discussing about the advantage of breastfeeding milk. So the first thing is like breastfeeding milk, it's coming from mother to fetus. So the first thing is this is sterile, right? It is sterile, free of cost. Okay, see, another we have transfer of antibodies from mother milk to baby, because mother milk contains certain antibodies that protect the baby from different pathogens that compete with different pathogens. So I means that this milk play important role in passive immunity. Another, we have developed bond between baby and mother. There is a strong relationship between baby and mother, right? Milk is sterile. Milk is sterile means milk is pathogen free. There is no chances of contamination or presence of any like presence of any pathogen. There is no chances, except if mother having certain disease like HIV, so then there is chances, but usually there is no chances of transmission of disease. The milk is sterile, free of cost. Okay, we will not can we will not expand money, we will not expand we will not expend any money on this, and less chances of allergy. Okay, no, like if person is using bottle milk, so maybe to baby having certain allergy to one of the component of that milk that produced industrially, but here is less chances of developing allergy. Okay, is it clear? All right, very good. Another one student is telling that having correct temperature, very nice. Yes. Okay, very good. Most of the students are correct. About the disadvantage, yes, you are okay. Disadvantage, difficulty in producing enough milk, embarrassment, like mother cannot feed everywhere to his baby. Okay, and nipple become painful and need mother always. This, like if it is bottle, so you can do bottle everywhere, but here it's need mother always. Okay, all right. Yes, there is. Yeah, I told you, like if a mother having certain disease like HIV, so that can pass through milk also to baby. Okay, this is another point. Thank you so much. Yes, damage beauty, I discussed about it already, like embarrassment. Okay, now let's move toward another question. Okay, first of all, we have to study about these two graphs. Okay, so you can see it here. Like the first thing is relatio consent. These two graphs show us menstrual cycle, the changes in hormone that is coming during menstrual cycle. So relative concentration of hormone in the blood, right? So if we can see it here, this is the different hormone that mentioned. The one hormone is follicle stimulating hormone. The one hormone is LH, right? So the first question, like if you can see here, it's like I told you already, the normal average time per menstrual cycle is 1 to 28 days. So the first, like the first 5 days in which the FSH hormone will start to increase. So the end there will be, this is a bleeding period. So that is from day 1 to 5 usually. And this time there will be like bleeding, and that is called menstruation, right? And after that, if you can see here, I told you that LH hormone will reach to peak on day 14, and that will cause ovulation. So it means that here, it means that if we see here, this time is with us, this time is day 14. and this is the time of ovulation. Okay, because here the LH hormone is at peak. Okay, and with LH hormone increasing, okay, so the function of that luteinizing hormone is ovulation, and ovulation is actually the release of ova from the ovary to fallopian tube. Okay, now we can also see it here about these are another two hormone. One they mentioned to us estrogen, and another they mentioned to us progesterone. But estrogen, then the name of estrogen they didn't mention here. Okay, but I told you in the lecture that like when estrogen reach to high level before ovulation, so it stimulate also LH hormone. So if you can see it here, so both reach to it peak, right? So at this time, what will happen? The process ovulation will happen. So directly that line come approximately near uh, toward this Y. So Y with us is ovulation. Is it clear? Y is ovulation. Here the process of ovulation take place, and Z is actually menstruation. Okay. Now, let's move toward the questions. State what happened at X and Y during menstrual cycle. So, what should happen here? First thing is, I told you already, it X the process of menstruation, right? It's a bleeding period. While and Y, what should happen? Please. Yeah. So, Y is ovulation, release of ova from the ovary cell. Okay, now, all right, now let's move toward another question, that is describe the rules of estrogen in controlling the menstrual cycle. So what should be the rule of estrogen in controlling menstrual cycle? It starts production before ovulation and repair, make the uterus lining thick, especially, and I mean endometrium lining thick for baby implantation. It also start developing blood vessels to the uterus so that there should be more supply to the uterus. Okay. Yeah. Estrogen prepare endometrium lining for implantation. Estrogen repair and make the endometrium lining thick and develop blood vessels to the uterus that ensure more supply of blood. Stimulate release of luteinizing hormone for ovulation. On day 14, it stimulates luteinizing hormone for ovulation. And after ovulation, estrogen inhibit efficit to stop production of more egg cells so that no fertilization happen again. Is it clear? Anyone want to take some hints? They can know. There is also in menstruation, there is also estrogen, but the level is less, gradually it increasing. Yes, you are correct. Ghana Ibrahim, you are correct. Reduction and the uterus size be an advantage of breastfeeding. Yes, this is correct. No, FSH actually didn't stop. Actually, estrogen after ovulation, estrogen inhibit FSH to stop production of more OVA. Like it actually, FSH make follicle cell mature to produce egg cell, but after ovulation, estrogen having effect on FSH, so that stop the FSH, so that no more OVA produced, because one already went for the process of fertilization. So if that fertilize, so no need of more OVA, no need of again fertilization. Then there will be embryo, and like two embryo for example develop, and that will be in different developmental stages and the uterus, right? No, it's happened after ovulation. All right, now let's move to our another question. Okay, some women have who can't conceive may be treated, may, may be treated with FSH, right? Some women having the problem to like develop embryo, conceive means to fertilize and develop embryo. Maybe dead people treated with follicle stimulating hormone. It's a fertility drug. If it is used is a fertility drug. Fertility drugs are those drugs that give to infertile female to develop baby. Okay, those some female having like some problem, some hormonal deficiency, some problem that they are facing. Because of that, they are unable to give birth to the baby. So for that reason, doctor mostly like he suggests for them are doctor mostly given to these female follicle stimulating hormone. Okay, that increase the chances of their fertilization. Now question is how it may allow a woman to conceive, how it may allow a female to have fertilization and having embryo. Conceive means this, okay? Now, we know first we should be clear about follicle stimulating hormone. This actually make mature, it's mature the follicle cells. If it is maturing the follicle cells, and follicle cell actually develop like it's help in the maturation of egg cells. So if more follicle cell is developing and maturing, it means more egg cell will mature and more egg cell will released. If more egg cell release, there will be more chances of fertilization. Okay, you can study. If it is given at the beginning of the cycle that stimulates the development of follicle cell that mature many egg cell, thus more egg cell produced that increase the chances of fertilization. Please study it now. If you want to take hands, you can. Okay, please. You can if you want to take hands. Yes, before ovulation. Okay, now let's move toward another question. Suggest one application of using fertility drug. So what you think about this question? Suggest one application of using fertility drug. Please. Like what conclusion you can draw from using fertility drug? What conclusion you can draw from using fertility drugs? Very nice. Allow infertility couple to have babies. Very nice. Okay. May lead to multiple birth. Very nice. Okay. Allow infertility couple to have child. May lead to multiple birth, and the treatment is like treatment are like buying these fertility drugs is also expensive. Here they just mean like what's the conclusion we can draw from it, like what conclusion come with us about it. So it's like all these we can understand from using fertility drugs. Like if we do like we use fertility drugs, so what can be happen? So allow infertility drug to have infertility couple to have child. So it's like we can also it's also expected cause of using fertility drug. So what's the confusion here then? Is it clear? All right, now let's move toward another. All of you wrote this, right? All right, now okay, explain why it is important that follicle stimulating hormone is not secreted during pregnancy. So again, same question, that why it should not be secreted during pregnancy. So remember, we should be clear about follicle stimulating hormone. It stimulates the follicle cell to mature egg cell. So if it releases in pregnancy and pregnancy already there is one embryo and we don't want to another embryo develop, right? So for that reason, FSH should not be secreted during pregnancy, right? All right. So it is important that follicle stimulating hormone may not be secreted during pregnancy so that no more egg cell produce and prevent the process of fertilization so no more embryo will produce. Okay? Yes, correct. Is it clear? All right. So if you want to take hands, you can. All right, now let's move toward another question. Is it clear? So this question is out of worksheet, but I selected it because some of my student questions were regarding this, and there were some were facing some confusion, like sexual transmitted disease, like HIV. Okay, like how mechanical birth control, uh, birth, right? So because of that reason, I selected. Okay, right? Now let's move to this question. A newspaper headline incorrectly stated the use of condom can result in erectile dysfunction. Now, question is what is erectile dysfunction? Erectile dysfunction is a medical problem which results in problems with sexual intercourse. It's a medical problem in which a person having the problem of sexual intercourse. Scientists are concerned that this incorrect statement could lead to increase in HIV. Now, the scientists are worried about this, that if people stop using condom because of the incorrect statement that mentioned in the newspaper, so that may lead to increase in HIV, right? Now, one of the students asked me that, sir, you are using sexual intercourse in your lecture, but what is the meaning of it? So let us do that. Describe the process of sexual intercourse in human, right? So what is that process? The first thing is the complete process like erection of penis and ejaculation of sperm and vagina. So this process is called what? Sexual intercourse. Is it clear? Hussein, is it clear? If you want to take hands, you can. Now, all right. Now, condom are used is one form of birth control. What's name is used to describe this method of birth control? So what is that? There is different types of birth control. We study chemical, mechanical, right? Surgical. So this is which type of birth control, please? Very good. Mechanical birth control method. All right. Okay. Explain how a condom act is a method of birth control. How it act is a method of birth control. You saying this was also your question. Explain how condom act is a method of birth control. So like it is a mechanical barrier, so it prevents the release of semen to female vagina, right? Semen trap and condom, so fertilization cannot happen because of sperm cannot reach to egg cell. Once again, listen. Semen trap and condom, so fertilization can't happen because sperm cannot reach to egg cell. Semen contain what? It contains sperm. So if it trip inside the condom. So it will not release to the female vagina, and that will not reach to oviduct, and that will not reach to egg cell. And so the process of fertilization will not. Okay. Yes, correct. If you want to take hints, you can. All right. Let's move toward another question. All right. Some readers of newspaper may believe the newspaper and stop using condom during sexual intercourse. Some readers, like the newspaper, mentioned that mistakenly, but some readers having trust on that newspaper, so they stop using condom during sexual intercourse. Explain how a decrease in the use of condom may lead to increase in incidence of HIV. Explain how a decrease in the use of condom may lead to an increase in incidence of HIV. You know, condom actually prevent the mixing of body fluid. If it is from male, right? Like from male semen, if it is from female vaginal fluid. So there will be no mixing of that. And HIV virus usually can transfer by these fluid. I mean, like by semen or by vaginal fluid. But now, condom actually stop the contact of that between the fluids, between your body fluids. That's why if there is no use of condom, so the incidence of HIV virus will increase. Okay? And then more people will have, like if they're having unprotected sex, so because of that, the chances of the HIV disease will increase. You can study it, please. Which student asked last time about HIV, gonorrhea, sexual transmitted disease? Which student asked last time? Please. Yeah, Ghana Ibrahim. So I will discuss that now. Okay. All right. Another question we have. State two ways by which a person who does not have sexual intercourse might still become infected with HIV. So we should know other ways of HIV. It is not only because of sexual intercourse. There is also other ways by which HIV virus can transfer. Like for example, blood transfusion from HIV infected person. So to that blood, it can transfer. Okay, even HIV can also transfer from HIV mother, HIV infected mother to the baby. It can happen through a placenta, or it can also transfer through breastfeeding milk. Is it clear? So these are the other ways through which HIV can transfer. Another one, we have sharing of HIV contaminated needle for drug injection. For example, one person used that injection for drug injection. That needle, he used that for drug injection. And that person having HIV and another person used that. So it means the needle become contaminated with HIV. Now another person is using. So the HIV transmission chance is more in that. Is it clear? Yes, with blood transfusion. Very good. Very good. Unsterile needle. So we will say our wording like that: HIV contaminated needle. Okay. Remember, HIV contaminated needle. Blood transfusion is actually the transfer of blood from one person to another person, from donor from donor to recipient. That process is called blood transfusion. Is it clear? All right, let's move toward another. I think it's clear to all. If you want to take hands, you can. Otherwise, I will go to another right now. Okay, all right. Let's move toward another. All right. Explain why immune system is less effective in a person with HIV. If you remember, I told you HIV virus attack on your lymphocyte, and that lymphocyte function is to produce antibodies. So if HIV virus destroy your lymphocyte, right? So there will be no production of antibodies, and when there is no production of antibodies, your immune system will weak. First thing is antibodies can like trap the pathogen. Another antibody can also enhance or increase process of phagocytosis. So these things will not happen in the body, or it will decrease in the body. Simply, I will tell you your immune system will become weak, so any pathogen can attack on your body. Even opportunistic pathogen can also attack on your body. Opportunistic pathogen is the normal organic microorganism that is present in your body, but it cannot cause disease to you. But when your immune system become weak, so get opportunity. Opportunity means chance, and that start attacking on your body, right? Is it clear? Let me repeat once again. HIV virus actually attack on T lymphocyte, and T lymphocyte function is to activate B lymphocyte so that they produce antibodies. But now HIV virus actually attack on T lymphocyte because T lymphocyte having a special receptor through which this HIV virus can bind. The name of that receptor is CD4 receptor. Okay, so when HIV virus destroy that lymphocyte, so your body is unable to produce antibodies because B lymphocyte will not stimulate. And when it is unable to produce antibody, so the immune, the process of phagocytosis will decrease. Your body will be unable to protect the, your immune system will be unable to protect your body from disease, and there will be more chances of getting disease. Any pathogen can attack on your body easily. I think it is clear. Very nice. Lojan, very good. Very good. Very good. Yes, the nutrients can transfer from mother to fetus across the placenta. But you say now be with me here. I'm here now. All right. So another sexual transmitted disease is gonorrhea. For this disease, state one sign or symptom of this. Another question you have one effect on the body. Another we have what should be the treatment. The first thing we should know about this disease, it is also sexually transmitted disease, and it is caused by Neisseria gonorrhea. It is the name of bacteria that cause it. So when I use the word it is a bacterial disease, so it means the treatment of this should be antibiotics. like antibiotics we are using to treat bacterial infection. So it's by this, like when I know it is a bacterial disease, so in this treatment I will write antibiotics. Now the sign and symptom of this disease is like there is different sign and symptom, but here I will tell you only few. First one is ulcer on reproductive organs, pus discharge from reproductive organs, like if but from for both male and female, for both, and pain when urinating, especially when male is urinating, so he will feel pain. So these are the sign and symptom of the disease. Okay, is it clear? So frequent urination is general symptom, like for like especially when there is UTI, urinary tract infection. So there I'm actually discussing your question. Judy Zaid, I'm discussing your question. Like it is just like the general symptom of the any urinary tract infection. So if it is UTI, definitely if it is UTI, so there should be frequent urination. Okay. So, but I'm discussing here the specific symptom of this disease. Okay. Okay. Like another question, who says that? Amar Radwan, right? So Amar Radwan, like pus is actually when like some wound happen, right? Or there is ulcer or whatever, there is some white white fluid that is called pus. Ulcer, what is ulcer? Ulcer is like when the skin break, okay, when the skin break and there is like a open sore, sore is sore, so that is called ulcer. Okay, so the effect on the body, it can damage reproductive organs, and because if we like it's not like that it will happen compulsory, no. If for a long time it remains without treatment, so it can lead to certain complications like damage to reproductive organ and fertility and abdominal pain. Is it clear? All right. Last one I told you treatment for it is use of antibiotic like penicillin. Any antibiotic you can use. It depends on the doctor what he can prescribe according to the situation. Is it clear to all? Hope it's clear right now to all.